and as they are written here, you have to write exactly the same answer in your semesters. So the first one is, there will be a case history given to you, a picture like this will be given to you, and the questions will be there like this. So the first case is, it is a case of a 15-year-old boy who incurs a lacerated injury to his right calf after falling off his skateboard on a pile of bricks. 10 days later, his histologic appearance of the dermis is shown. This is the histologic appearance of the dermis. So the first question will be, name the histologic change shown. The second question will be, what is its composition. The third question will be, which growth factors are responsible for angiogenesis. And the fourth question will be, what are the types of wound healing. So if this problem card comes, then these questions will become, and this is the picture which will be given to you, and you will have to answer these questions. So you can see, this is the picture of a granulation tissue. Here are the new vessels formation, thin walled blood vessels, and you can see the RBCs inside the blood vessels, and you can see these histiocytes, and you can see the chronic inflammatory cells here. Okay. So name the histologic changes shown. So the histologic change shown is granulation tissue, and the cells are fibroblasts and new small blood vessels. So the composition is the fibroblasts. So these cells are the fibroblasts, these elongated cells, these elongated cells, these are the fibroblasts. Elongated tapered cells, these cells are the fibroblasts. These cells, these are the this one, this arrow mark, these are the fibroblasts. These fibroblasts, they cause contraction of the wound, and these small blood vessels, this one, this one, this one, these small blood vessels, they are the main component of this granulation tissue. The next question is, which growth factors are responsible for angiogenesis. Then you have to name these three factors, VEGF, FGF and angiopoietins. There are many factors which are responsible for new blood vessel proliferation. You have to mention these three at least. These three factors you have to mention, VEGF, FGF, vascular endothelial growth factor, fibroblast growth factor and angiopoietins. These three factors you have to mention. And healing. What are the types of healing? Healing may be of healing by primary intention and healing by secondary intention. These are the two types of healings, healing by primary intention and healing by secondary intention. These are the things you have to write down in the answers. So this is one problem card. Any queries? This will come in your semester and maybe in your finals also. Any query? So move on to the next one. Case number 8. So here 15-year-old Chinese girl, the ethnicity is mentioned, Chinese girl, had her earlobes pierced. Over the course of the next 4 months, she notes the growth of a nodular scar tissue to 1 centimeter in size. The lesions are excised and their microscopic appearance is shown. So this is the lesion which has been excised and it is the microscopic appearance of the lesion. So what is your diagnosis? Question number 1. What is the mechanism of its formation? Question number 2. What are the phases of cutaneous wound healing? question number 3. And what family of enzyme is important in wound remodeling? This is question number 4. These are the 4 questions which will be asked with this history. Okay. So coming to the first question, diagnosis. Diagnosis is hypertrophic scar. This is called a hypertrophic scar. Don't tell it as don't confuse it with keloid. This is not keloid, this is hypertrophic scar. You don't perform a surgery on a keloid. Keloid, in case of keloid, surgery is contraindicated, so don't confuse it with keloid. You tell it as hypertrophic scar. So mechanism of formation, there are same thing, there are fibroblasts and new small blood vessel formations. And apart from that, there are excessive collagen deposition. Excessive collagen deposition. Due to this excessive collagen deposition, in any healing there is some amount of collagen deposition, but this excessive, you have to write this term excessive. This excessive collagen deposition leads to that hypertrophy of the scar. So this is the excessive collagen deposition, this arrow mark. This is collagen being colored. There is excessive amount of collagen deposition, you can see in the picture. So this excessive amount of collagen deposition has caused the scar to become hypertrophic. So the mechanism of formation is excessive amount of collagen deposition. Phases of cutaneous wound healing. At first there is inflammation, then proliferation and then maturation. So what are the phases of cutaneous wound healing? So you have to write the phases of cutaneous wound healing are, at first there is inflammation, then there is proliferation of the cells including fibroblasts, and as in the previous one, there is proliferation of the cells and there is maturation of the scar. And the next question is, what family of enzymes is important in case of wound remodeling? So the family of enzymes is called matrix metalloproteinases. Okay, just you don't have to know how it causes the scar remodeling or all this, you don't have to write in your problem cards. You just have to name this enzyme, matrix metalloproteinases. This much is enough for the problem cards. It is not a theory class, it is just the discussion about the problem cards. This will come as problem cards only, and you have to don't write a long theory on it. You just have to mention these 4 points. 4 questions and these 4 important points. Now the next one. This is the case of a 47-year-old female who had varicose veins in the left leg and was on prolonged bed rest after hysterectomy. She suddenly developed swelling of the left leg, pain and red discoloration of the skin. This one. Compare it to the right leg. This is swollen, reddish discoloration of the skin and developed pain. So what is the diagnosis? Name the triad and the component which predisposes to the pathology. Name a few hereditary factors which can cause it, and what are the microscopic features of this pathologic lesion. So this is a problem card. So what is the diagnosis? The diagnosis is deep vein thrombosis. As the patient already has varicose veins, means the patient already has venous stasis, and the patient is in prolonged bed rest, that means the patient is almost kind of immobile. So, there is always a chance of deep vein thrombosis. You have already read the chapter of thrombosis. Prolonged immobilization causes and venous stasis is a predisposing factor to venous thrombosis. Then the next question is, name the triad and the component which predisposes to the pathophysiology. So, the triad is Virchow triad. You have to remember this. It comes in your theory question as well. Here you have to write the Virchow triad, and Virchow triad consists of endothelial injury, alteration in normal blood flow, and hypercoagulability of the blood. These three components together forms the Virchow triad. Endothelial injury, then alteration in normal blood flow. Normal blood flow is a laminar blood flow, that means the cellular components of the blood flow in the middle, and the plasma component of the blood, they flow alongside the vessel wall. This is the normal blood flow, which is called laminar blood flow. If there is an injury to the blood vessel, or there is alteration in the viscosity of the blood or hypercoagulability of the blood, then what happens? The normal blood flow is hampered. That means the cellular component comes directly in contact with the blood vessel wall, and then the process of thrombosis starts. We will read in details in the chapter of thrombosis, but in the problem card section you have to mention only the name of these three things: Virchow triad and endothelial injury, alteration in the normal blood flow, and hypercoagulability of the blood. These three are the components of Virchow triad. What was the next question? Name a few hereditary factors which can cause it. Hereditary causes of hypercoagulability. Factor 5 laden mutation, which you have read about the coagulation pathway, the factors involved in coagulation. There is a factor called factor 5. Mutation in the factor 5 causes hypercoagulability. Antithrombin 3 deficiency causes hypercoagulability. And protein C and protein S, these are the factors which prevents blood from clotting within the blood vessels. So, if there is familial deficiency of protein C or protein S, there will be a hypercoagulability in the blood vessel. Means the blood will automatically, there will be automatic automatic formation of blood clot within the blood vessels. So, these three are the main hereditary factors responsible for hypercoagulability. So, you have to mention these three factors in your problem card. And what is the next question? What will we get in the microscopic features of the pathologic lesion? What will we get if we see the microscopic features? We shall get the lines of Zahn representing the pale platelet and fibrin deposits or with alternating darker red cell rich layers. So, when there is thrombus formation, there is a layer of platelet and fibrin layer, and there is above that there is a layer of RBCs. Above that again there is a layer of platelet and fibrin formation, and above that there is another layer of RBC rich layer. So, there are alternating darker and paler layers. So, these are called lines of Zahn. So, these layers you will find in case of thrombosis. So, this is what we will get in microscopic picture. So, you have to mention this word, lines of Zahn. And if they ask what is lines of Zinn, you have to tell that this represents the pale platelet and fibrin deposits with alternating darker red cell rich layer. Okay. So these are the 3 problem cards for your first semester, and there are few also be taught to you later. So that's all.